When most people hear the word sleep apnea, they typically think that their only option is CPAP. But CPAP is not the only option. Properly made dental sleep devices made by a qualified dentist can be a viable alternative to CPAP. In this video, I'll give you a brief overview as to what these devices look like and what they do. So come on, let's take a look. Hi, I'm Dr. Rick Van Gerp, a dentist at Carolina Sleep Solutions in Charlotte, North Carolina. Sleep apnea is a serious disorder that robs the body of the precious oxygen it needs to survive and thrive, and it's associated with a wide variety of medical problems. It can also affect your quality of life. At Carolina Sleep Solutions, we make custom-made, medically approved dental sleep devices to treat obstructive sleep apnea and snoring. We're highly trained and will work with your physician and your medical insurance, including Medicare. If we can help you, please let us know. So, let's jump into today's topic. Properly made dental sleep devices to control obstructive sleep apnea and snoring represent a very good option for those patients who can't tolerate or are unwilling to use CPAP. In fact, the American Academy of Sleep Medicine, this is the principal physicians' organization for health issues related to sleep. They consider dental sleep devices as a viable treatment for obstructive sleep apnea and snoring as long as the devices are made by a qualified dentist. Now, there are many different dental sleep devices that are FDA approved, and they all essentially do the same thing. They move the lower jaw forward. So, how does that open up the airway? I'm simplifying it here, but because the tongue is attached to the lower jaw, by moving the lower jaw forward, you're also moving the tongue forward, which prevents it from dropping back into the airway and potentially blocking it while you sleep. Second, moving the lower jaw forward also tightens or stretches certain muscles associated with the airway, making it less prone to collapse. So here's an example of a dental sleep device. There are two parts to it. One part fits in the upper teeth and the other part fits on the lower teeth. These devices are comfortable, they're easy to use, and as you can see, they're very portable. In the mouth, the upper and lower pieces are connected to one another in such a way that as a unit, they move the lower jaw forward. How they actually connect can vary with the device. Each device is custom made and they need to be custom made. Research shows that custom made devices work better and especially fit better. And the better it fits, the better it's going to work for you and the less likelihood of side effects. Each device we make is also adjustable. You can see here that there are adjustment mechanisms on these devices, and by using a key, you can move the mechanism and thus the lower jaw forward. This is an important feature. By being adjustable, we can incrementally move the lower jaw forward until we feel we've reached the sweet spot where you're feeling good, your snoring is significantly less or even eliminated, and of course, your apnea is controlled. We can then verify how well your apnea is controlled with a sleep test. After all, the goal is not only to help you to feel better and get better sleep, but also to significantly reduce the number of times that you stop breathing. And we can only determine that with a sleep test. Be that as it may, like I said, we want to find the sweet spot. We only want to move the lower jaw as far forward as we need to in order to be effective at opening the airway. Now, while these dental sleep devices all move the lower jaw forward, a specific device may be a good option for one person, but not for another. In other words, it's important for the dentist to select the most appropriate device that works well with the condition of your teeth, your jaw joints, and your airway. This comes down to the qualifications of the dentist in selecting the best device for you. So to sum up, dental sleep devices can be a great option to help you control your sleep apnea and snoring. If you'd like more information about dental sleep devices and Carolina Sleep Solutions, please check out our website. Thank you so much for checking out this video. Please hit the like button if you would, and definitely subscribe for more videos just like this one. Finally, if you suspect you or a loved one has sleep apnea or a problem with snoring, please share this video with them. If you have sleep apnea, you really need to treat it. Until next time, remember, at Carolina Sleep Solutions, we want you to breathe well so that you can sleep well and be well. Thanks for watching. See you next time.